She's an awesome dog. Just like the queen of the house, you know, I mean, it's like her domain.
She's pretty much the matriarch of the dogs.
Her hips have been bad since she was a puppy. The right hip is worse than the other one.
When she started walking funny and couldn't get up the stairs from the backyard,
She'd want to go outside, but she'd have to drag her back legs up the steps.
we couldn't see that anymore.
It took us a while to get anybody to do anything about the hips, but Dr. Edinger was just like, oh, we can absolutely do the hips.
You know, when I met Sabriel, it was pretty clear that she was a very important family member. I looked at her and could see her x-rays and so on and know she had the hip arthritis that she did. A hip replacement would be the best thing for her.
I had no idea that they did, you know, hip replacements or knee replacements or anything like. I didn't know they did them for dogs.
And the biggest thing to decide was not whether she needed a hip replacement, but whether at some point she might need both hips replaced.
And he said, which one do you want to do? I said, probably the worst one. So we started out with the right hip.
Putting these parts in that have to go into some really exact places and then having it all work, it's incredibly satisfying.
It was so apparent about 9 months after she'd had the first hip done that she was ready to have the second one done.
She ended up getting 2 new hips, and now at just over 10 years old, she's running around the backyard with all the other dogs like a puppy.
That's wonderful. She's happy.
We can say, hey, Sabriel, you want to go see Dave? And she gets all excited. She starts jumping around. When the dog acts like that, to go to the vet, there's got to be a special thing out here for that to happen.